One of the main inclusion criteria for the LIFE study is that patients should be unable to mobilise after 72 hours following their injury. What was the rationale behind this? Well, even though they've broken their pelvis, there are certain patients who, because the ligaments around the pelvis are still intact, they're able to mobilise safely and indeed independently, albeit with a walking aid such as a frame or a stick. They're still able to mobilise and get up out of bed. And because these patients are not going to be susceptible to the complications of immobility like VTE, chest infections, urinary tract infections, etc., actually it's very unlikely that they will benefit from any kind of surgical intervention. So the patients who we wanted to include were ones who were still unable to adequately and independently and safely mobilise themselves within 3 days of the injury. And that is therefore the rationale for this part of the inclusion criteria.
In this sequence, we see a patient at 72 hours ready to be assessed. For patients to be excluded from the study, they must first successfully stand up, walk 3 meters, walk 3 meters back, and sit down. This patient was seen successfully completing all aspects of the task and would therefore be excluded from the study. Patients can be included in LIFE if they are unable to stand independently, if they require physical assistance at any time during the assessment, if they fail to complete the 3 meters and back due to pain from their pelvis, if they fail to sit down safely without physical assistance. If a patient fails any aspect of this assessment, they can be approached for the LIFE trial. It is important that the research team confirm with the clinical team that the assessment has been performed in this manner. We've found it helpful in the past if the research team actually observe the assessment.